Good morning, good afternoon, and good evening, wherever you are joining us from. Welcome. Thank you for joining us for this very important symposium that will dig a little bit more deeply into what is going on in the HIV PrEP for pregnant and breastfeeding populations. We know that this remains a very relevant topic when we look at some of the estimates of the 1 to 2 million new infections that have occurred, 2020 estimates. And then when we think about the fact that roughly half of those are going to be amongst women, we see that this is a very relevant issue when we look as well at the 30 years worth of history and improvements that we have had in the ARV realm that have taken this from an acute disease into a chronic management process. I'm sure that you'll enjoy the information from our wonderful presenters today that present the broad range of perspectives from Ministry of Health to clinician to donor as we get a little bit deeper into everything. Next slide. You'll see who we are and where we hail from in terms of bringing you this conversation to expand the knowledge about PrEP for pregnant and breastfeeding women. And we're going to get right into things today. Next slide, please, with our first presenter representing the clinical aspects of PrEP care.
Thank you very much, Pandora. Good morning, good afternoon, good evening. I'm going to take you through lessons learned from expanding HIV PrEP for pregnant and breastfeeding women within maternal, neonatal, and child health service delivery settings in Lesotho. This is a project that is being piloted by JAPIGO and the Ministry of Health under choice support through USAID funding. Next slide, please. Evidence has demonstrated that pregnant and breastfeeding women are at a higher risk of HIV acquisition due to biological factors, which are thought to be hormonal, immunological, and also due to social and behavioral factors. Evidence has also shown that women who become infected during pregnancy and breastfeeding have an increased risk of transmitting the infection to their infants due to viral load compared to women who became infected before pregnancy and breastfeeding. This is why it is very important to screen this population and provide them with PrEP in order to prevent vertical transmission of HIV. WHO supports use of PrEP for pregnant and breastfeeding women who are at continuing risk of infection as part of comprehensive HIV prevention interventions. This information is available at WHO recommendations on antenatal care for a positive pregnancy experience. Next slide, please. Lesotho has the second highest HIV burden globally at 22% among adult population 15 to 59 years of age. This is why prevention is key to controlling this epidemic. This is based on the FIA 2020 results. HIV prevalence among pregnant women is also high at 22.8%. That is why offering PrEP as an additional HIV prevention strategy is important. PrEP was introduced in the country in 2016 during the test and treat launch, mainly targeting individuals in several different relationships at facility level. It was only in 2018 when PrEP was now scaled up to include both facility and community models. And the community model was led by JAPIGO, targeting key populations such as AGYW, adolescent girls and young women, female sex workers, and men who have sex with men. And of course, anybody at substantial risk of being infected with HIV. Low PrEP uptake has been observed among pregnant and breastfeeding women at MNCH sites, mainly because PrEP services were targeted towards women in several different relationships, as mentioned above. PrEP is also poorly integrated into SRH services. For example, family planning department provides FP services only. And a woman who also needs PrEP will be referred to another department to go and queue once again. This results in missed opportunities as sometimes women leave the facility without having been provided with PrEP. PrEP for pregnant and breastfeeding women component was integrated into the 2020 National EMTCT guidelines using content that was created by Choice. Next slide, please. This is a brief background of Choice. Choice is a 24-month collaboration which is funded by USAID in partnership with PEPFAR through EPID and RISE projects. The goal of Choice is to address technical gaps and support national scale-up of PrEP in PEPFAR-supported countries through translation of evidence into implementation. In 2020, Choice created a global toolkit of clinical and implementation resources to support expansion of quality PrEP for pregnant and breastfeeding women for countries with high HIV prevalence. This was done in partnership with other maternal and neonatal health stakeholders globally. Next slide, please. So this toolkit is adaptable, and countries working towards introducing, implementing, and expanding PrEP for pregnant and breastfeeding women can adapt these materials to suit their context based on their local policy, the clinical guidelines, and implementation context surrounding PrEP provision for pregnant and breastfeeding women. The resource package consists of clinical guidelines for PrEP eligibility and management, provider training curriculum and supplemental reference materials, which include facilitators' guide, safety surveillance materials for monitoring maternal and infant outcomes. There are also selected support materials such as implementation guidance, pregnancy wheel with SOP for providers, and facility readiness checklist for assessment of PrEP provision in ANC and PNC settings. This toolkit is available and can be downloaded from the link below. Next slide, please. These are the sample materials that come with a package, and I've already mentioned them in the previous slide. Next slide, please. Here we see an example of the training package overview. The course consists of 10 modules, which can be covered in 2 full days if the course is delivered in person. It can also be adapted to suit a virtual model. The training is designed to be interactive using different training modalities such as PowerPoint presentation, case studies, role plays, and group discussions. Evidence suggests that learning within the workplace is more effective at impacting performance over traditional training approaches of offsite workshops that have limited effectiveness in impacting and maintaining provider performance after completion of the training. So in Lesotho, we conducted on-site training sessions over a period of 4 days, only in the afternoons when providers have seen the pregnant and breastfeeding women in the morning hours. Next slide, please. Here again, we see some of the materials that were created by Choice to generate demand among pregnant and breastfeeding women. They complement the clinical and the training curriculum resources. They consist of PowerPoint slides, facilitation guide, and prototypes for adaptation. They were also part of the adaptation process in Lesotho, and they will be published to PrEP Watch in fall. Next slide, please. This is the process that we followed towards implementation of this pilot. We had advocacy meetings with the Ministry of Health through its different departments to pilot this toolkit through training of providers in health facilities that already provide ANC and PNC services. These meetings were followed by a workshop to now review and adapt the training curriculum to suit the Lesotho context. 2 facilities were then selected to pilot this toolkit. And in July, 21 providers from the 2 facilities were trained on PrEP for pregnant and breastfeeding women toolkit by JAPAEGO and the Ministry of Health using the adapted resources. On-site post-training mentorship support is ongoing, and will go up to fall of 2021. Next slide, please. We are already getting some positive feedback as we continue to support providers at MCH sites. There is an increasing PrEP uptake among pregnant and breastfeeding women. 63 women were initiated on PrEP from July up to date, that is after the training. This is an average of 15 clients that are now being seen per month. Prior to the training, 14 clients were initiated between March and June, which gives us an average of 3 clients initiated on PrEP per month. Client flow has also improved within the MNCH unit, and it has resulted in integration of services as clients are now being seen under one roof. PrEP is now integrated into ANC and PNC health education or counseling sessions. This gives women time to think about PrEP and then make informed decisions as they wait to be provided with services. There's now an improved use of PrEP screening tools, the screening assessment and the eligibility screening tools, which were not uniformly used prior to the training. Baseline assessment tests, baseline blood tests are routinely performed post-training, and this was not the case before the training. On the other hand, we see mothers who are not able to make decisions to start PrEP on the first visit, as they express the need to go back home and consult with their families. As much as PrEP must be taken willingly and when the client is ready to start, starting late poses a challenge as these women come back later having seroconverted. And please note that these are yearly observations at the time of this presentation in October. Next slide, please. We are continuing with joint mentorship visits to these 2 facilities with the Ministry of Health and other partners, and this will go up to the end of October. The team will conduct stakeholder survey in November to better understand the feasibility and acceptability of the training course and provision of PrEP within this MNCH unit. And finally, the evaluation report to document the field test process and stakeholder feedback will be shared with the Ministry of Health and donors to inform decision-making on PrEP integration into MNCH services. Thank you very much. Back to you, Pandora.
Thanks, McKenna. Of our I think we might be having a technical glitch in the slides, but we make it work in this virtual world as we get ready for our next presenter to give us the perspective of the Ministry of Health and what it's like to actually get PrEP rolled out and to the clients that need it so much. Over to you.
Thank you, Pandora. Good morning, good afternoon, and good evening. My name is Rosina Pateli-Sihla from Ministry of Health. I will take you through the priorities for integration of PrEP for pregnant and breastfeeding women into MNCH settings in Lesotho. Next slide, please. The outline of my presentation, I will take you through epidemiology. I will also touch on the implementation of PrEP as well as the recommendations. Thank you. Can we continue, please? The Lesotho HIV epidemiology. Lesotho is hyper-endemic with adult HIV prevalence of 22.7%, 15 years and above, and people living with HIV of about 324,000, with the annual HIV incidence of 0.45%, approximately 5,000 new HIV infections annually among adults. Next slide, please. Women are disproportionately affected by HIV. The burden of HIV is higher among women than men, with an incidence of 0.81% amongst women aged 15 to 49 years versus 0.33% of their male counterparts. The prevalence of 27.9% among women 15 to 49 years versus 15.7% in men of the same age group. And this shows that the women are more affected. Next slide, please. The prevalence amongst women aged 25 to 49 years of age is 4 times higher than their male counterparts, which is 28% in women and 7% in men. And the women aged 20 to 24 years have HIV prevalence of 13% compared to men of the same age group with 2.4%. As we can see in our epidemiology, that in these age groups, the previous slide and this one, they are all the people who are at the childbearing age. So it is very important to notice that if they are having this high prevalence, and it shows that they need interventions for prevention. Next slide, please. Next slide. So the Lesotho policy status on PrEP for pregnant and breastfeeding women. Lesotho government supports implementation of new, innovative, and more effective evidence-based interventions to prevent and control the pandemic. And PrEP for pregnant and breastfeeding women falls in this category. We have 2016 national guidelines on the use of for prevention of HIV, care, and treatment, which introduced PrEP in our country. So this shows the support that the ministry is, the Lesotho government is having with regard to the effective evidence-based interventions. We also have the 2019 addendum, which supports PrEP for pregnant and breastfeeding women. We have also integrated PrEP into the national EMTCT guidelines. Next slide, please. As to why do we need to integrate PrEP into MNCH settings? Apart from the epidemiology that I have already shared with you, we also have the studies which have been conducted in country which support integration. HIV prevalence among pregnant women is high at 22.8%, and we have over 4% of HIV negative women attending ANC who reported having HIV positive partners, according to these studies. We also have zero conversion among HIV negative women at study enrollment at high at 3.3%. And this shows that if they are zero converting, it shows that their children are at risk of conducting HIV. So we need to take interventions which are more aggressive. Next slide, please. Implementation of PrEP for pregnant and breastfeeding women. The Ministry of Health, in partnership with Choice Team, contextualized the PrEP for pregnant and breastfeeding women tools and training materials. So MOH engaged HIV program, supply chain, pharmacy department, and PMTCT program. As we know that in the HIV program, we have different units, which includes HIV testing services, monitoring and evaluation, and we also have surveillance unit, as well as social behavioral change communication unit. They were all part of this partnership. So the implementing partner also were part of this program when we were doing the adaptation process. They were part of this, they took part. Next slide, please. The Ministry of Health conducted a baseline assessment on the current state of PrEP provision and facility readiness to offer PrEP to pregnant and breastfeeding women with the support from Choice. And the sites were selected based on high volume PNC and ANC attendance. We also trained the healthcare workers together for pregnant and breastfeeding women in collaboration with the Choice team. The adapted course is being piloted by Ministry of Health and the implementing partner staff at the facility level. We are also conducting the joint supportive supervision and mentorship, as my colleague has just mentioned earlier on her presentation, that we are doing the joint supportive supervision as a team of Choice team, Ministry of Health and implementing partners. Next slide, please. So in implementing this pilot, there are lessons learned. We have learned that there is increased uptake of PrEP among pregnant and breastfeeding women. Now we are seeing the average of 15 new PrEP enrollments per month versus an average of 3, which was there before the pilot. The main reason for a variation is that at times we find that some of the women are not ready to start PrEP. So it says that we need to take other measures to ensure that all women who are eligible to take PrEP should take PrEP, especially when they are pregnant and they are breastfeeding. So targeted training for MNCH providers is needed to build competence and confidence to provide PrEP to this population. Healthcare providers are very positive about the initiative. This has been noticed because they have mentioned it during the supportive supervision and mentorship, that they usually see women who are pregnant and breastfeeding, who are seroconverting, while they started ANC with the HIV negative status. So this says to us we need to ensure that the interventions are done so that we can control the epidemic. Next slide, please. We have these recommendations. Adaptation of the toolkit to reflect the national implementation and policy context is essential. Continued support to scale up integration of PrEP services within the MCH settings is needed, as we have already mentioned the importance of integration and the need according to the studies which have been conducted. Continued rollout of this training to reach additional providers and increase PrEP uptake is very important, because if the people are trained, they will be able to deliver the key messages to our clients so that they can see the need to start PrEP. Next slide, please. In summary, Lesotho has high HIV burden, and women are disproportionately affected by the HIV epidemic. Policies promote PrEP for pregnant and breastfeeding women, and integration of PrEP services into MNCH settings is very important to control the epidemic through prevention of new infections. Thank you.
Thank you for that overview. Never enough time to get into all of the details. I'm sure we can talk a lot and have many, many questions for you, which we'll get into after our last presenter comes to us with yet another perspective.
Thank you so much, Pandora. Good evening, good afternoon, and good morning, everybody. I'm Anouk Amzel, and I am from USAID, Washington. and I get to wrap up this session. The Lesotho Ministry of Health has always been on the forefront of new and innovative services, HIV services. And so this collaboration between them, USAID, and the Choice Initiative represents another significant advancement, this time in the important agenda of increasing access for pregnant and breastfeeding populations to HIV prevention services, and of working towards EMTCT, the elimination of mother-to-child transmission, through inclusion of PrEP in the national PMTCT guidelines and the introduction of the Choice PrEP for pregnant and breastfeeding women training toolkit. Lesotho has made significant progress in expanding access to HIV prevention services for this priority population and contributed important lessons learned for other countries to consider. The integration of PrEP into the maternal, neonatal, and child health service delivery platform, where pregnant and breastfeeding populations are already receiving antenatal and postnatal care, helps address an unmet need for HIV prevention options among women who are pregnant and breastfeeding. The provider training, the implementation support, and the demand generation resources presented during the session today are an important new resource that can help other countries to include provision of PrEP for pregnant and breastfeeding women into national HIV prevention and/or PMTCT guidelines, expand provision of PrEP into MNCH and family planning service delivery settings, and to help generate demand for PrEP among pregnant and breastfeeding populations, addressing key information needs among both clients and providers. Through this partnership between the Lesotho Ministry of Health, USAID, and the Choice Initiative, we've learned important lessons about the process of introducing and expanding provision of PrEP to pregnant and breastfeeding women through the MNCH service delivery platforms. With brief training and follow-up mentorship, we can increase healthcare worker confidence in providing PrEP to this population through improving their confidence in managing common side effects of PrEP during pregnancy and breastfeeding, addressing common questions and concerns, and ensuring that services are well integrated, efficient, and client-centered. USAID is very pleased to see these resources available for adaptation and use in other countries, and look forward to seeing continued advancements in targeted HIV prevention services for pregnant and breastfeeding populations. As we ramp up the use of PrEP for pregnant and breastfeeding women globally, we also hope that in the near future, these populations can gain access to even more choices for HIV prevention, such as the dapivirine ring and CAB-LA, pending, of course, accumulation of reassuring safety data and dedicated attention to addressing their unique needs. Thank you so much.
Thank you for that, Anouk. And we have a little bit of time for questioning, so I want to jump right in and pull from each of you. Based upon what you have told us about today and your experience with this, if a country was thinking about adapting this PrEP package, which is easily available for adaptation, what would your advice to them be? If each of you could take about a minute to do so from your positions at the table, what would you say? Anouk?
Thank you, Pandora. I think based on what we discussed today, we heard very clearly from May McKenney and May Racina that we still have challenges with women feeling comfortable accepting PrEP when they first come in and are discussing it with their provider. So I think apart from what's already been done with the trainings and all of the wonderful tools that Choice has shared with us, I think really focusing on community awareness and demand creation will be key in the next steps. I think once everybody is aware of this really important prevention option, women will have potentially already discussed with their families, with their partners, and will come prepared and asking maybe even for PrEP when they show up, because we all know women will do anything to protect their babies in any way they can. Thank you.
Thank you for that. And May Rosina from the MOH to speaking to another MOH.
Hello, I didn't get your question. It's like we are having a connection problem. Can you repeat it, please?
Yes, speaking from the Ministry of Health perspective, what would your advice be to any country that is looking to adapt and scale up based upon this package of materials and your experience? What advice?
Okay, thank you very much. I would advise that this toolkit is very important and it needs to be adapted. However, since it is some of the resources which may not be available in other countries, I think it's best to just ensure that we have, especially the human resource. It's important to have human resource, because if we do not have human resource to implement this package, it will not help us a lot, because what we have experienced as the country have been that we do have a shortage, a limited number of people who are implementing, especially the counselors. We are having a challenge with that, so we need to have counselors because the demand is becoming high. So we need to have people who will help people so that we can ensure that the services are available at all times. That's all what I can say.
Thank you. And last but not least, our clinical perspective, what would your advice be?
Thank you, Pandora. My advice would be for all providers to be capacitated on this toolkit so that they can be able to provide quality integrated services, thus contributing towards elimination of mother-to-child transmission of HIV. Thank you.
Many thanks to all of you for your words and your wisdom as we look at where we're going next with all of this. And I think you've given us some sage advice when we consider human resources capacitation in this, and I think this model actually could provide another adaptable piece to insert into pre-service education. And as we think about how important it is to meet the community where they're at every single level, and to provide the care where the people are as they need it, I know that we're going to see a bright future, not just in the upscale of PrEP, but in the protection of women and children everywhere and across the globe. Thanks for your time, and we look forward to seeing you a little bit online for any other questions and answers that you might have. Take good care.